Welcome to the Pivotal Podcast. Today we're joined by Dr. Thanos Melisiotis, an accomplished physician, clinical informaticist, and entrepreneur. We'll explore Thanos' unique journey from an early interest in technology to his innovative work in health informatics, his entrepreneurial ventures, including Chiron Medical Technologies, and his vision for the future of healthcare with AI and QiiQ. All right, Thanos, thank you so much for being here with me today. I really appreciate it.
Yeah, thanks for having me.
Yeah, absolutely. So to get us started, can you tell me a little bit about how you began this journey that's led you to become a healthcare entrepreneur?
Oh, yeah, it's a pretty long journey, so you got to bear with me. I mean, it started really as a young boy, much like every origin story does. I had a huge interest in technology. My dad was all into the latest technology, computers, electronics. So that was like my passion, and I loved programming, and I started that at a really young age. So always involved with IT and technology in general, and I had also a passion for medicine. So I wanted to go to medical school, but I also loved computers and programming. And eventually, I had a startup when I was in college, which I had to then continue into, when I went into medical school, I had to kind of give that up a little bit. There was a transition period. And then after medical school, I wanted to marry those two things together that I loved, both technology and medicine. And, and then I pursued a lot more of these projects that involved healthcare informatics and kind of solving problems using my skills.
Yeah. What was your focus in med school? For?
So I went into emergency medicine, which is a great field because it allowed me to, as an attending, it allowed me some time to actually do some of these entrepreneurial projects since I didn't have a regular or a typical 40-hour work week. I had a lot of, day or night shifts that allowed me some time when I was off to work on my private ventures.
Yeah, absolutely. So can you tell me a little bit more about that? So from what were you seeing, and what's coming to my mind is cognitive load issues, right, in the emergency department. But can you tell me about how that led to, I guess your ideas for the different ventures that you've launched?
Yeah, I think one of the first times when I was an attending, I realized, we have a lot of responsibility now on us that we didn't have as students and residents. And I realized how many small administrative tasks that we had to do that you don't really think about it too much when you're a resident. Like, sure, you have to make some phone calls, place orders. There's a lot of documentation and a lot of tasks that you're like, hey, this is, adding on a lot of non-medical related tasks to my busy day. And then it impacts your patient flow and then your patient care. So I wanted to spend more time doing the patient care and less time doing a lot of these tasks. And one of the problems that I noticed, I guess one of the first problems that led to a solution that was a start of Chiron was around code resuscitation, where we had someone comes in, they may be having cardiac arrest, you're doing CPR. One of the things we have to also do when we're doing CPR is also document. And it takes away from your ability to do some tasks. And usually it's a nurse that's doing the documentation, but then you're wondering, hey, that nurse also needs to be involved in the resuscitation. So something kind of has to give, whether you're going to give good resuscitation or perhaps bad documentation. And hopefully it's the documentation that ends up being poorly done, right? So one of the first things that I started focusing on was better documentation that was easier to do than writing it down on a piece of paper, which I believe, if I remember correctly, we were capturing about 25% of accurate documentation when it came to timestamps and the content. So I created a solution where it allowed you with a touch interface to quickly document something, everything that was going on with the resuscitation. but it also allowed you to reduce cognitive burden of knowing all the algorithms for resuscitation. So it even told you, it guided you by voice. Hey, 2 minutes is up, check for a pulse. It recommended based on the ACLS guidelines, the American Heart Association guidelines, hey, if your rhythm had changed, what medications should you be considering? Should you be shocking? Or, basically based on the algorithm, it would give you suggestions. Again, we're not saying that this was definitely guiding the resuscitation, but it was supposed to be there as a prompt in case you didn't remember. That way we didn't blur medical device kind of categories. And so it documented, it gave you some guidance, and in the end, you got a better outcome. Well, the outcome was the same, hopefully, but the documentation portion, the administrative portion was better. And,
right.
And then you kind of look at ways to expand on that, integrations with the EMR, third-party vendor type of integrations, and it could just keep on going. So it was an exciting project in this whole field.
Yeah, that's amazing. Now, and you mentioned 25% accuracy to start with. Do you know where you guys were able to get to with Code Blue?
Well, unfortunately, as this project didn't get into a post implementation type of phase, so it was really used as a almost like a proof of concept. It was a minimal viable product in the startup terms, but it was a proof of concept to show, hey, this is where you could start using these types of tools to improve a process. Once you implement it, we could start adapting it to the overall workflow. And unfortunately, that we didn't get to that phase. And there are other complicated, confounding variables to that, much like any other startup would recognize. You need to have a lot of value to it and a monetary value. And even though documentation is important for resuscitations, it's there's not a lot of dollar signs associated with it. So it's hard to push a project that doesn't have a good return of investment.
Yeah, absolutely. That makes sense. So tell me more about what you're working on currently.
Well, Code Blue and Chiron kind of led to me thinking, hey, what other problems are there in medicine that we're really burdened by administrative tasks? Like, I'm spending so much time at a computer, and I'm really anchored to a computer. So I have to do all my work at a workstation, and that could be, 5 feet away. It could be at bedside, or it could be across the department. It all varies. So that I'm, everything from documentation to order entry to just perusing the chart to see what's going on with my patients and what do I have to do next. All these things focused around using a computer, and in an ideal or not so ideal location. So I met my co-founder and partner with Dave Brown over with QiiQ, and we started this idea of trying to mobile or create a mobile interaction with a lot of these workflows and reducing our dependence on the workstation. So now we took all those functionalities of the EMR, put them in the pocket, and then we leveraged natural language processing to help complete all these tasks. So now instead of having to go to an EMR and log in, type things in, search, and place or do whatever activity, now I could actually pull up my assistant on my phone, quickly log in with Face ID or your thumbprint, and I could do things like place an order using my speech or document or browse the chart. So I don't have to go back to a computer when I'm seeing 5 patients. I could just go from one patient to the next and just complete all those minimal tasks.
That's amazing. Tell me more about the role of large language models in that.
Well, so this all started using natural language processing, which is a precursor to what we now use with large language models, which there's still a role for natural language processing, NLP, because it's not very resource intensive. It does require some programming up front and predicting how people ask questions or how they, what their intents are. So we do things like intent analysis and entity extraction. So you may be asking for something like, show me the labs for the patient in room 5. it's pulling out your intent, which is show me the labs, and the entity is room 5, which is the patient's location. And then it could call the function to the our API that says communicate with the EMR and pull the required information. And right now, that's it's super fast using NLP. Now, if you looked at on LLMs, you can do the same thing, but you're pretty much allowing the LLM, the model, to decipher what you're asking and hopefully get you the answer. But it's not as predictable. And NLP is very predictable. LLMs are very powerful, though, so great for large volumes of data to try to summarize or pull some content out of it.
Interesting. Okay, yeah. So that's super interesting, because I feel like there's a lot of buzz around like AI and LLMs and things right now, but it sounds like for this use case, they are more of a burden on like draining resources and maybe not producing the result as consistently also.
Yeah, and it's a great point. So it's you want to use the tool that's appropriate for your task at hand. So if I want to you don't want to use a bazooka on something if you want to swat a fly, right? So use a fly swatter. It's going to be very effective, precise, probably cheaper than that bazooka. But that bazooka is really sexy, right? Everyone wants that bazooka because it just does a lot. But you don't need to obliterate that fly.
Yeah. Interesting. So interesting. So with that, and you mentioned integrating with EMRs, right? I'm sure there are probably challenges that you have to face trying to make something that's going to talk to those things, right? And I would assume the challenges probably fall into a couple of different categories, maybe in the technical side of things, but also there's probably something related around like regulatory issues and what you're allowed to do. Can you tell me just about like the various challenges, like when you're even approaching, how do we build a solution for these problems that we're experiencing in healthcare? Like, what kind of challenges do you run into?
Yeah, that's a pretty loaded question. So I'm going to try to break those down, because there are a lot of challenges. There are many challenges, and regulatory challenges are probably the hardest ones, because you do want to make sure that you ensure privacy and security for the patient information. So you do have things like HIPAA, which is, to be honest with you, in my personal view, is a pretty low bar, and it's based on things that were established many years ago, that you consider protected health information. Without getting too much into the details of that, like I said, it's a pretty low bar, but you always want to be above that bar. You want to always look forward and ensure that you do have security and privacy in mind for your patients. So, you want to get certifications that ensure that you give some level of trust to your clients and to your patients, saying, "Hey, we've been vetted, we've been tested, we've been, penetration, intrusion, all of that done." So all very important. And then your administration from the hospital wants to ensure that, you've done those things. So the CIO may be thinking, "Hey, I got to make sure that you're a third party now having access to our patient information. I need to make sure that you're not some small company that's going to have ransomware issues in the future." So you do want to dot all your I's and cross your T's. And that's difficult. It's long and it's expensive to go through, but it's all with obviously a good intent. It's very important. From a technical standpoint, when you're doing integrations, we have some pretty good standards when it comes to integration. We've had HL7, some like older standards, which are very reliable, very well documented. But they're, again, expensive and time intensive to implement. And we have newer standards like FHIR, which allows you to integrate using REST APIs, which are a lot easier to read and integrate, but they may not give you as much functionality as the old school APIs do, or the old integration. But you pretty much can do everything that we need to do with the new APIs. But again, we have some flexibility on integrations with specific vendors, EMR vendors, depending on what we need to do.
Can you give me an idea as to what the time frame looks like from idea phase to I think I'm going to start working on this and solving this problem and developing this solution to, hey, we're actually going to start deploying this as like an MVP or even beyond?
And that could all depend on how big of a problem you're trying to solve for. I think anyone that would be starting off with a problem, it'd be starting off with something small, so that way you're not overwhelmed by a lot of these pieces that need to be completed. But you could use tools that are very basic. So you could use things like Python to help code something that gives you a pretty quick result. It could be a very simple problem, and I can't think of something just off the top of my head. But let's say you just wanted a quick answer to something that normally takes you a very long time to go through the chart, and you wanted to expose that as a web service. So you literally would be calling an API. Again, without getting too much into the weeds of that, you could write a program that performs that action, and then launch it within your own ecosystem, within your health system, a lot easier. Than, let's say, if you were trying to do that as selling that as a third-party vendor. So a lot of the projects do start in-house, like in a health system, that have specific problems that they're trying to address. And you could integrate those into EMRs even, so they don't have to be just these one-off solutions, or they're standalone and don't integrate. You could do things within your health system, and then have your IT folk help you integrate that into the EMR. So you could look at things, a project could take a month or two to just kind of hash out, draw it out, create an MVP, like a prototype, and then test it. Obviously, testing is super important, and you could deploy something within pretty quickly, actually. And then, of course, if you wanted to take that idea and then expand on it, we're talking about simple solution to a complex product. Because if you're looking at a product versus just a solution, there are a lot of steps in between those.
Mm-hmm. Yeah, that makes a lot of sense. So you wear a number of different hats right now, right? So you're a physician, educator, startup founder. How do you balance your time between those areas? And I mean, how much time, like say in a week, are you roughly spending in each one?
Yeah, that is a tough question to ask, because that is a struggle that I have going through. I've been going through for quite a while now, and one of the other hats that I wear is also a father and a husband, which is you always have to leave time for some personal life. And one of the biggest challenges is doing any one of those things and doing it well, and enjoying it, for that matter. And if you try to do too many things, there's going to be a compromise somewhere. Yeah. So I found that over time, I've had to narrow down, what am I focusing on? What are my priorities? And, my family is where I sit as my number one priority. Because that's what I value the most, and everybody, again, can have different priorities, but for me, that was my number one. And then I was trying to figure out, my entrepreneurial efforts are really, if I think of my goals in life, are really to help implement some kind of change that is a little bit bigger than me and my local community. I really want to make something of a difference. So I do see my entrepreneurial efforts as a means of doing that. So I do put that pretty high on my list to say, hey, this can go somewhere. It can make some changes. So I do focus a lot more on that. And then my clinical responsibilities are obviously very important, because that's really what puts food on the table. So I go to work. I'm 100% when I'm at work. I do everything that I need to. But there's a compromise there where I'm not as I'm not able to do additional or take on additional responsibilities within my department or the School of Medicine. So some of my colleagues, they're amazing at teaching and They have additional courses that they take on. I'm not able to do that as academic faculty. So there is a compromise in that. But, I prioritize where I see I'm able to, and hopefully I'm not dropping anything. So
Yeah, absolutely. How many kids do you have, and how old are they?
I have 4 kids. I have a set of twins that are turning 5 in a few weeks. I have a 2-year-old and a 3-month-old. So we're a pretty big young family. So
yeah, that's amazing. My kids are 8, 5, and 3, and I know what chaos looks like, or what life looks like, and how chaotic it is in our house. So I can just imagine if I just doubled my number of 5-year-olds right now, like where that would be, and then traded my 8-year-old for an infant. It's like, yeah, I can imagine. I mean, but it's amazing, right? I don't remember if we talked about this previously. I think I've mentioned it before on here, but there was a book I read called Your Life Well Spent, and it totally reframed my perspective, my definition of success. Previously, like, I was really more in alignment with the standard American definition of success is building this thing business wise or whatever it's going to be that's going to result in financial prosperity. And I mean, it does take money to live. Money's important, and I want to provide a nice lifestyle for my family. But the premise of this book is that really success is more in terms of like the legacy that we leave. And as parents, our number one opportunity for shaping the next generation is typically through our own children. So really setting aside like time for my family is my number one priority while I'm juggling everything else. It's become super important. And it's amazing how little things built into our daily routines can really foster that. I think it's easy for me to think like, oh, it's got to be this massive thing that we've got to do, right? But for my kids, if we went to the playground for 15 minutes, it was like they got to go do that thing. Like, as an adult, I'm like, 15 minutes, was it even really worth it? But for them, they're like, no, we either did it or we didn't, and we got to do it today. So I've created these rhythms where, like, every morning I'll get up at like 5:45, jump in the shower because that wakes me up, and then I get out, and first thing I do is try to spend 10 or 15 minutes having a cup of coffee with my wife, and then after that, getting ready and spending during the school year. Our oldest, our daughter, is not a morning person, so she's not up for like the early morning adventures. But our 5-year-old is super morning person, and he's like, hey, if you want to go outside and skateboard or pitch a baseball to me to hit for 15 minutes, like, we do that every day. There was one day last week where then our 3-year-old also asked me in the morning, like, hey, can we just sit and look at like pictures in Google Photos? Can we just scroll through some Google Photos together? And so we did that, and it was like, maybe all these little things, maybe they added 45 minutes to my morning routine or something. So instead of getting up at 6:30, I'm getting up at 5:45, but it was worth it because like I had that connection time to start my day with, like, the people that are most important to me.
Right. Yeah, absolutely. I completely agree with all of that. Because those brief moments, like you said, to you, it's like 15 minutes, but to your kid, it may feel like a lot longer. And the implication is huge. They're like, oh yeah, I'm spending some time with my dad, this morning I sat down in the hall playing race cars with my son. We have a remote control cars, and it's just a thing that he loves to do that he only does with me. But it's a small amount of time, but it means the world to him. And that, to me, again, high on my priority list, where I put things with my family and my kids, because it's, in the end of the day, what recharges me, I'm glowing every time I talk about my family and and it's, you could always argue you'd be in a very different position or a different place had you not had these things, these other responsibilities, but I wouldn't have it any other way. It's so important and to my core, like who I am right now. And it sits on top for that reason.
Yeah, absolutely. Absolutely. Thinking back to like, oh, there are these classes I'm not able to teach, or maybe I can't pursue this other project. Well, and even in my business and recruiting, like, there are other people that could and I have a big mission of like who I want to help career wise, right? Or organizationally. But at the end of the day, other people could also, like, if I'm not around, other people can get help elsewhere, right? Or it can provide the help. But like, if I'm not showing up for my family, like, they're just absolutely, they're not getting that, right? Because I'm the only person that's going to be that husband for my wife and support her in that way, or the dad for my kids and support them and love them and guide them in that way. So yeah, having that priority there, it's in the right place, you know?
Right.
And
Yeah.
then,
And I think that priority, it is very individual. Some people, they do put career very high on their list, and it may, not that it goes above family, but it may be pretty on par with it, where they may compromise somewhere. Maybe they won't spend that 15 minutes or something, but they fill in other ways. So, and I'm never going to be the guy that says you should be doing this. This should be a priority, because it is very individual, and some people, they don't go down a family route. So, but I think it is very personal, and so long as you can agree with that, and you're not really deceiving yourself, and you're just being honest with yourself, I think you're just going to be a happier person. So, and you can balance things a lot better when you just sit down. You say, "Hey, this is my priority list." I could check in with that list and say, what am I doing right now that's preventing me from keeping those priorities straight? And I find that's the best way to kind of get it all done, and make sure you don't really waver from that.
yeah, I'm a huge proponent of list making. I think my wife thinks it's ridiculous, but it's like, I mean, I put it on the list just because if it's important to me and it's on my list, it'll get done,
Right.
So tell me about your work at UPenn. What does that look like?
So I'm an academic clinical emergency medicine physician. So I do most of my work within the emergency department doing clinical work. So I teach the residents and students there on shift. And then that's both at a trauma center and a large tertiary hospital, university hospital. So, or quaternary. It's a huge health system. Amazing things that they could do there, amazing resources. Can't ask for a better health system to work for. I mean, they really are. They go above and beyond for their patients. So it's a great place to work and get supported from for as a physician and as a patient. So, and then after that, I do have some academic responsibilities where we do some resident conferences and some additional activities, whether it's the journal clubs or some other events that really help support the academic mission. So that's primarily what I'm doing. I also sit on some committees at the hospital, primarily revolving around informatics. So whether it's on an enterprise level or down in the department, I kind of sit in on those and weigh in, again, wearing my AI hat, my physician hat, and my informatics hat, my general policy and implementation kind of hat. So I like to think that I provide value in those as wearing those different hats.
Yeah, absolutely. So you mentioned informatics, and then when you're looking at things through the informatics lens, what do you look at as our big problem that we're facing right now, or our biggest opportunity for improvement?
In healthcare in general, or are you talking about at an individual system level?
Yeah, maybe health. I mean, either way you want to take that, whatever resonates with you.
I think one of the biggest problems that I see in healthcare is generally access to healthcare. And it's a tough topic because there's a lot of political and, pretty much it's politically, there are a lot of different views on this because we do have a large population that does not really have a way of getting adequate healthcare. Whether it's because they don't have something physically close to them, or they don't have money to get follow-up, or they don't have insurance. And sometimes it's just medical literacy or just general literacy. They may not understand what they need to do and how important it is to follow up, and then connecting those people to the services that they need. So It may be something that we see in the emergency department. Somebody comes in and let's say they broke their ankle playing a sport or something. And, you get your x-ray, you put them in a splint, you give them some pain medicine, you do everything that you would do in the emergency department, and you do it to the best of your abilities. There's nothing else that you have to worry about at that moment. But then you worry, hey, where are they going to go to follow up? How do you connect them to the orthopedic surgeon who may need to do an intervention? They may need to make sure that it's healing properly. They may need surgery. And so then you're like discharging them from the department with a paper that says, okay, here are your instructions. Here's the orthopedic surgeon that you need to follow up with. Follow up in a week, and that's it. Like I'm kind of disconnected from that visit at that point as an emergency medicine physician. The problem is once they leave, did they really understand what they need to do? Are they able to read those instructions? Are they going to read those instructions, or are they going to just throw them away? And for scheduling that follow-up, are they able to? Do they have a phone? Do they speak English? Are they able to actually communicate with the doctor that you referred them to? And if not, do they have the means of finding the doctor that they need to? So there's so many of these social determinants of health, which is another big buzzword right now in healthcare, that really impede on a patient's ability to get long-term care. And it doesn't just stop with that acute care visit in the ER. It's really post-acute care or post-hospitalization. All of those factors are critical in their success in getting better. And that's a pretty simple example, right? The ankle fracture, but you can imagine there's chronic disease states that need a lot of follow-up. Medications play into a role. Can they afford them? Do they know alternatives? Are they taking duplicate medicine because one's a generic and one's a brand name? I've had toxicology patients that come in with toxicity because they're taking the same medicine, but they're just a different name. And that's like, again, a lot of areas where informatics could have caught and prevented issues, but it kind of describes an overall problem that we have in healthcare, which is not a lot of interconnection. And it's not just interoperability, but just connecting people, physicians, and the people that kind of support those patients.
Yeah, interesting. Especially when you talk about the social determinants of health, right? And because a lot of it does come back to cost of care, but cost on society as well, right? And I wonder if you've seen this when it comes to informatics, as when we gather data and we can show that adequately addressing or preventing a lot of these issues and addressing that population that maybe have the negative outcomes, like the poor health outcomes. If we can be more proactive in addressing it, we actually save money long term.
Oh yeah, absolutely. And we look at those from a specific disease states or in general from a population health. If you're looking at trying to implement strategies that prevent people from getting hospitalized, and again, without getting into political discussions about how COVID was handled, but vaccinations and all of that. Just again, not specific to COVID, but general vaccination, how they prevent people from getting hospitalized, but also helping contain perhaps an outbreak. So you'll see if you don't have good vaccination schedules or the ability to see if people were vaccinated for other communicable diseases, then you risk spreading something unintentionally. So it could be COVID, it could be rabies, things like that. If you're looking at things from animal vaccinations, or general child immunization strategies, and you get outbreaks of meningitis or something in a school. So that'd be one example. But then you look at, I don't want to get too far off on it. There are many ways that information and access to that information, whether it's through the primary care doctor or at an acute care visit, will help facilitate proper management of that patient. So like, hey, you didn't get your COVID booster, maybe you should get one now that you're coming in with your fifth asthma exacerbation this winter, and you're at high risk for bad outcomes for that. So I really suggest that you get that. But it's up to them to do it or not, but it could affect what I am suggesting to them.
Yeah. Interesting. So, okay, I feel like we've looked at it from the patient outcome side of things, right? What about from the provider burnout side of things, right? Like reducing burnout, improving retention, overcoming the talent shortage in healthcare. When you think about these types of things, what role does informatics or could informatics play in that?
That's a great question, because I am a huge advocate for integrating information to where it needs and presenting it to where it's needed to help reduce cognitive burden, which is the number one cause for burnout. So I don't have the study to quote it right now, but I do have those references I could provide later. But if you look at the number one cause for burnout, it is actually the amount of time you're spending in an EMR and doing these administrative tasks. So I could be, the fact that I'm just going to put arbitrary numbers here or theoretical numbers. Let's say I'm spending 30 minutes looking through an EMR. If I reduce the amount of time, from 30 minutes down to 10 minutes, I've now reduced my frustration of having to sit at a computer for 30 minutes. But now I'm also able to do other things and provide better care, whether it's talking to the patient a little bit longer, feeling less stress about it, or spending a bit more time for the planning phase and getting them better care, frankly. So informatics can play a really good role of reducing burnout if you implement it properly. So look at the problem. Why are the people spending so much time at a computer? How can you reduce that time at a computer? And how do you improve their quality of life really at work and decrease their cognitive burden? And there are many ways to do that. It's just chipping away at it. I don't think there's just one simple solution. But if you reduce that burden, reduce the burnout, I think you're going to get a better retention rate. You're going to get fewer people leaving, which has a direct it's very expensive to get a new doctor. Very, very expensive to find and hire and onboard a doctor or a nurse for that matter. So you can imagine if you're reducing your burnout, reducing the rate of people leaving your practice by improving the way they are able to do their work, by improving their tools, you're going to reduce your cost of getting new talent. There are many ways that it could actually improve your bottom line financially. But I think that's one of the ways that like a CFO can look at and say, hey, this burnout is a huge problem, and let's make it be better for people who work here. Let's make them happier.
Yeah, it makes a lot of sense. I was talking to somebody yesterday who was saying, don't give us another session on joy and cultivating joy. And you know what I mean? Like another webinar on this or whatever it is. Actually, if the burnout's not coming from us not stewarding our rest time well, it's coming from having a lot of frustration in working in our EMR, for example. So it's like if you could reduce the actual causes of burnout or stress or tension or frustration in our work environment, that's going to reduce burnout a lot more than like just being more mindful of how we're resting.
Oh my God. Yeah, I think I had someone else tell me like they had a mandatory wellness and I forget the term exactly they used, but it was essentially managing burnout and looking within to help manage the burnout. And the biggest complaint of that of the people that they were addressing was the fact that it was mandatory. So people were like complaining that this burnout session was burning them out. So stop making it. Stop trying to patch the problem and address it. Address the actual problem by finding a solution to it, not by. I think we're all aware of it, So stop trying to just make us all aware to address the underlying problem. And that's hard, it is hard. No one says it's going to be easy, but we have to take those steps in order to move in the right direction.
Yeah. Yeah, absolutely. So with all of these sorts of things in mind, I feel like obviously they're very top of mind for you as an entrepreneur as well, right? And with QiiQ, can you, I don't know, give us an idea of what else you think might be an interesting problem that you would have an interest in working on in the future?
Well, we're looking at right now at QiiQ, we've done a lot of work again with on the mobile front, taking tools and getting them people away from the workstation. And a lot of the discussions lately have been around like ambient documentation, where people can put their phone down, have a conversation with the patient, and it creates a chart for you essentially that you could review and then sign it. And we've done that work as well. It's one of the tools that we've developed and part of our package of the assistant. But we have to look at outside of just one simple problem. And sometimes it's taking a lot of those little tools and bundling them up into one nice package that just makes sense to use. So I think one of the biggest challenges that we have is, how do you make all those tools that, again, may be solving for a specific problem, how do you make them all play nice in a way that's intuitive for a user, like an end user, so that you're not actually creating a more of a burden for someone to use it. So you don't become another hard to use app that's just another burden to the user. And that's a challenge. And it's, the way that I feel that we're addressing it is just applying user-centered design principles, where you look at, hey, don't add 10 icons onto a screen and calls to action where you're just, widgets essentially all over your screen. Make it very specific to the workflow. So, hey, I'm on a patient's chart. I have an abnormal finding. Make it easy for me to address that abnormal finding, whether it's documenting it, whether it's ordering something. There are a lot of ways to look at those interface challenges and make something beautiful to use. And that's one of our, QiiQ's ethos is just user-centered design, make it about ease of use so that you could decrease your burnout and your cognitive load. And as far as tools go, I mean, we could spend a long time on potential tools, challenges around communication, documentation, social determinants of health. I mean, that's like a huge one, that there's so many problems with it. I think we just need to find small incremental improvements to get people really the long-term health care that they need, and prevent returns to the hospital, reduce costs overall. And that could be as simple as, connecting people, finding tools that help connect people to external providers, helping people a lot of people have cell phones. I think the majority of the patients that come to the emergency department have cell phones, and they may not even be able to afford some of their medicine, but they have cell phones. And that could be specific to Philadelphia and some, government programs that help get people cell phones. But now if we have a population that has cell phones, how do you leverage that access to a cell phone and additional informatics tools that can help deliver what they need? So whether it's help connect them to external providers, help them connect to their medications, resources, maybe a chatbot of some form to help them, find what they need, so that if they don't know what to do, at least they have a way to find the answer to that, so they're not resorting to Google or worse, some unreliable source to find out what to do next.
Yeah. Oh man, Dr. Google. I hear Dr. Google a lot.
It could definitely help in situations, but it tends to, unfortunately, it biases a patient into what they need, because they tend to search for what they believe is going on, and that could influence the results that they get back, because it's all about searching and keywords. It's not necessarily, it doesn't understand context. And that's what the role of a doctor is. It's have the context and the story to help put it all together. And that's a whole other topic.
Yeah. Yeah. So thinking about it from both the clinical setting and then also the entrepreneurial startup venture setting, when you look at providing optimal care, obviously requires a team of people, right?
Mhm.
What's the biggest challenge you find in either or both of these settings, in terms of assembling the right team or finding the right talent to help you achieve your mission?
Hmm. Um, do you feel is that more specific to the team within the health setting, the healthcare setting, or the team around the patient and their support system?
Um, Hmm. Maybe more so on actually like your side of things. So not putting together like the support team and saying, okay, you're gonna need a physical therapist, you need this and that. But I
Right.
mean, and actually for you to work most effectively in each setting, feeling like you have the right talent to support you in your mission. Yeah,
Mhm.
like what's kind of the big challenge, or what's a common challenge maybe as a leader that you've seen in both those
Okay.
areas?
That's going to require some introspection.
Yeah, sure.
um,
Let's bring it on you.
I mean, the team is very important within the emergency department. Team is very important because it determines your ability to execute. So whether you have a critical patient or you have a very busy department and you're just dealing with volume, making sure that you have a not only a competent nurse but a an effective nurse, so that they're good communicators, they're knowledgeable, um, is very important, and the support team around them as well. So whether we have our techs, the clerks, transportation, even security plays a large role in helping prevent um, some security issues, whether it's a violent patient or unauthorized access. Every one of those people are critical to providing exceptional care in the department. And as I mentioned before, like where I work at Penn, I really feel like this health system does an amazing job of getting top tier talent, and people that care. And it really shows as a physician the difference what a good team can play versus a resource poor health system. Um, and I've worked at many ERs actually because I did. I've worked as a locums doctor where I was hired, worked in several different ERs per contract on an as needed basis. I think I'm at 13 or 14 hospitals total now, ERs. And I've seen health systems that do it right, and I've seen health systems that, because they're resource limited, are unable to give you that solid team, and there's a compromise, and it's generally not because it won't fall on poor healthcare. You won't get a patient that doesn't get what they need, but it may not go as smoothly, or you may get a very aggressive patient that doesn't get security, at bedside quickly to help contain a situation. So a lot of things can happen when it comes to team, when it comes to the clinical delivery of healthcare. And then if you look at that and extend it to the informatics side, again, a resource-rich environment can help give you tools and develop tools that make your practice easier. So let's say I'm in the ER and something as simple as adding a cardiologist to the discharge instructions, like follow-up care. Having a good IT team informatics team will help add that pretty quickly. Or if I wanted to add additional discharge instructions to it, or let's say for COVID, we added all of these icons that helped label COVID patients or patients that were being tested for COVID that were screened positive, so you were potentially at risk for having communicable disease. It made it very easy for us to say, hey, they're in isolation. We didn't expose ourselves or other people unnecessarily. So we contained the risk of disease by having a good team that helped implement those changes. If you don't have a good team, if you don't have the resources to have informatics team that could help make those changes, you're not going to be able to have that same level of assurances. So everything from clinical work to informatics and those kind of changes that you could deliver on from a population health standpoint, all matter. They're all affected by the quality of your team.
For sure. What advice would you offer to somebody who is interested in transitioning into an informatics role?
I think we talked about this a little bit before too. It's identifying, first of all, like what do you love doing, and it's you may be coming from a different background, so you may be a nurse that wants to go into informatics, or you may be someone that's in information services or IT that's looking at developing tools that the physicians and the nurses are going to use. Or you may be a doctor that's like, hey, I'm sick of some of these things that are going on. I really want to get involved in making the tools better. So knowing a little bit about what your background is and knowing what you want to do with that. So I'll use the physician as an example because that's just where I can speak firsthand. If you've identified a problem, like I did with Chiron, I said, hey, this resuscitation software or documentation is kind of bogus right now. Let's create a solution for that. I knew I wanted to go in a direction where I'm creating the tools directly and then implementing them and hopefully testing and growing them. So I knew that, clinical informatics would be the route that I went through, which is a little bit more of the clinical application of the health informatics side of things. As opposed to someone that's in data sciences, let's say that you're in research and you want to do health informatics from a population standpoint, population health. So you're like, oh, I love this stuff with communicable diseases. I've been doing that research and now I really want to look and see how can we make, vaccination schedules better or making it easier for someone to discover what people's vaccine schedule is like and is it complete or are there fallouts. Now I could go down a route of taking some data science courses and maybe a health informatics type of curriculum, or start with a project at a health system to help, again, small project and get your feet wet and see if it's really what you like to do, and hopefully that grows from there. Because you could get formal training, you could go get your, go to a university and get actual coursework and even a master's degree, or depending on, if you want to go bachelor's of sciences and informatics or a master's in some of these other programs. It all depends on what you truly want to do. And there are many paths to getting you there.
Yeah, totally. Figure out what you love, what you're interested in doing.
Love.
And then, okay, long term, what does that look like career wise? And then, okay, let's reverse engineer that pathway to get there.
Right. Because the worst thing I would think that you could do is like saying, I think I want to do health informatics, but you don't really know what that means. And you're just kind of like taking up coursework or doing projects that don't lead you to where you ultimately want to be. And it's because you just haven't really sat down, created a list of what you want to do, and then reverse engineering and find out, how do I get there? How do I get to that point where I'm, making those tools that I'm passionate about? Because that's like the best feeling when you find those, when you make something that works and people also agree that not only that it works, but they love it. That's like a drug to me. That's worse than other drugs that are out there.
Yeah. Oh, it's amazing. That's great. Well, I know we're drawing to the end of our time here together. Is there any final thoughts you want to leave us with before we sign off?
You've asked a lot of great questions, and I feel like I've rambled a bit about a little bit on the technical side of stuff, but you did start touching upon a lot of important parts of like learning about informatics and how do you connect people into doing informatics when they have an interest in it. And there are a lot of resources out there for people that are interested in informatics in general, about learning about more and then getting involved, whether at an institution or on a national level. There's professional organizations that you could even get involved with as a student, or if you're in career, things like HIMSS or AMIA. Those are just two that I'm just mentioning here, but there are several ways to just get a little bit more information. And then it's finding a mentor that can help you kind of answer some of the questions that you may not know the answer to or know how to find the answer.
Or even what are the right questions?
what are the right questions? I just want to talk to someone that's been doing this, and like, what do you suggest I could look into? Who can I talk to? And just making connections with people. So mentorship is really, I think, it plays a big role in getting people to the next step. And I can't stress that enough. And I've mentored people, both students, residents, other physicians, and I think that's a huge, invaluable tool to have. Someone like they could just reach out to, and most people want to talk, and they'll be more than happy to talk and provide guidance.
Yeah, that's amazing. I love that. If anybody wanted to keep up with your work at QiiQ and what else you have going on, is there a place they could find you online?
Yeah, well, they can find me online personally on LinkedIn. I'm pretty responsive on there. Or they could also look at what QiiQ's doing on our website. It's QiiQ, which is QiiQ.health, and they can see the latest developments that we're doing on there.
Yeah, well, perfect. Thank you so much, Dr. Melisiotis. I really appreciate you being on here today, for sharing your journey with us. You're really, I don't know, you have a really unique perspective from both the clinical side and then also the business side of things. So I think that people are going to get a lot of value out of that today. So thank you so much.
You're welcome. It was a great time talking with you.
Yeah, absolutely. For our listeners, we'd love to hear your thoughts and experiences on this episode. So you can share your comments on LinkedIn or directly on the podcast website at pivotal.buzzsprout.com. And if you know somebody in healthcare who'd find this episode inspiring or beneficial, please share it with them directly. And you can stay tuned for more episodes here on the Pivotal Podcast, where you can listen live on LinkedIn or anywhere else you get your podcasts. Until next time.